things that we are convinced about is that we have a lot of human service agencies in our communities, and persons who are living in generational poverty often access those services. They access them frequently, they access different services, and agencies that are effective do extraordinarily well meeting urgent needs. What's been missing is the capacity to link agencies together, to create a network, a coordinated, integrated network of agencies, so that when one agency has effectively provided a service, that a person who's been living in generational poverty and who has more than one need at one time can be effectively referred and handed off to other agencies. And so one of the challenges facing persons in generational poverty is that they have a multiplicity of challenges facing them. They end up needing to go one at a time to individual agencies that excel in meeting urgent needs, but don't have the capacity to do the warm handoff. We're thinking that what's going to be important is to create an integrated network, a system of care in human services, so that just as in healthcare, if one has one urgent need met, someone makes the determination of what that individual dreams of, where that individual is seeking to go, what are the aspirations of individuals, because people in poverty have dreams also, but they're also facing multitude of barriers and walls and challenges and closed doors. We think what's useful is to help individual agencies increase their effectiveness and their efficiency by working together. One of the reasons we are making the case that poverty is a condition that can be addressed, it is a condition that can be treated, it is a treatable circumstance, is that often the bias and the stigma associated with living in poverty over generations is that it's the individual's fault, it's the family's fault, that there is no hope, there is no dream, there is no future vision within that individual or their family. And I know that not to be the case, and you know that not to be the case, but changing that context, changing that culture of cynicism that persons who are in poverty could do better but don't want to do better is a huge work. As a minister and a physician, it's part of preaching the gospel of the capacity to dream, even if we've been stuck in poverty, even if the circumstances have been such that we have not had the opportunity to overcome the burdens and the barriers and the challenges. But preaching the gospel that if given the path, and if given a process and a mechanism and a mode and a means, I can dream and I will follow a path of my own choosing that will get me out of urgency and emergency circumstances to a point of economic self-sufficiency. That's a huge cynical bias that we often have to overcome. Unfortunately, the public doesn't believe that. Sometimes human service workers don't believe that. And that's somewhat understandable if we've spent our entire careers seeing people needing and accessing the same services. But I believe at my core, and we really believe that if we train our agencies and change the culture of the persons who are there on the front lines, and inform our agencies that they're not only there to do extraordinary one-off services and meet urgent needs, but if we change and shift and enhance the culture that people really can move beyond that bias and that prejudice and understand that someone who is accessing a service in a program is not there because they want to be, but maybe there because they need to be, and would appreciate the opportunity and could craft a path and would follow the way that they choose, if possible, to move from where they are in their current urgencies and exigencies to a much better state. That's what economic mobility is about.